Good morning. Good morning. Hello, Canna fam. Welcome to May of 2022's Health is Wellness program. Thank you so all for joining me from wherever you're joining from. Please make sure you let us know in your comments. Thank you so much for joining M for MM's Health is Wellness. We are so grateful that you could join us today. I'm broadcasting live from beautiful Las Vegas. But what I'd really like to do is jump into our topic today because it is a sensitive one. I like to make sure that topics that we're talking about really address things that hit everyday people. And we know with everything that is happening in the world, the increase of depression and the increase of mental instability and people really fighting to try to keep their happiness and joy through some really difficult times. We know that addiction is on the rise, and people are really kind of stuck. And so we are hoping that this program today will really help inform you about how cannabis and other plant medicines can be used to help with addiction recovery. A lot of times we are getting propaganda that says, cannabis is a gateway drug. I know everybody has heard that before in their fourth grade DARE program. Cannabis is a gateway drug. Well, us in the cannabis community that understand this plant as medicine recognize that cannabis is a gateway drug out of addiction, out of pain. And so we want to talk about that today. And I'm going to quickly read to you this article that came out just recently, last month, from Cornell University. Some research had been done that shows that legalization of recreational or adult use marijuana reduces demand for costly prescription drugs through state medical programs. According to an analysis by Cornell researcher and a collaborator, when states legalize marijuana, the volume of prescriptions within the drug classes that align with the medical indications for pain, depression, anxiety, sleep, psychosis, and seizures significantly decline. This is something that is profound. Now that we have had states that have been on board, medically legal or adult use legal for more than 5 years, there is some significant research that is coming out proving that when consumers, clients, patients have access to cannabis, safe, regulated cannabis, that they are reducing their use of prescription drugs. And so that is amazing. I know that's not what Big Pharma wants to hear, but those are the facts. And so today I'm so excited to have my guest on. He was a panelist of mine last month or earlier this month. The time goes by so fast, right, Nurse Mark?
Oh my gosh.
But earlier this month at the G4 Summit, he was my guest for a panel that I moderated talking about why plant medicine should be used in recovery. So Thank you so much, Nurse Mark, for being here today with us. We really appreciate it. I want to get started with you introducing yourself, if you would, and letting our audience know who you are, who is Nurse Mark, and how did you find yourself initiated into the cannabis industry, into the cannabis space?
Yeah.
Welcome.
Nicole, I got to tell you, it was such a pleasure to be with you in Vegas, and I'm just so honored to be here now with you to talk about this because this is groundbreaking, right? This is the future of addiction treatment. What we're going to talk about today, wrapping in cannabis, and we will talk about other things too, right? We're going to talk about some other things as well. So, oh my God. So my story, well, listen, I was cannabis agnostic for like 35 years. I didn't care if you used it, but I never used it. Right. And that was really a result of my going into the Marines at the age of 17, right? So that kind of prior to that, I had extensive experience with cannabis and all sorts of other things, being a rebellious teenager. But when I went into the military, that was it. It was done. So I didn't go back to it for a long time. And so my history is I'm an entrepreneur, and I ran a technology company for 30 years that I founded and was really successful. I was looking at my life, I do these deep dives, right? So in 2010, I'm looking at my life and I'm saying, well, geez, I got it knocked here. I don't have to work very hard. I make a good living. Everything's
Right.
great, but
Yes.
I don't feel like I'm in the right place. You know what I
Mm.
mean? So I
Hmm.
looked, I said, well, healthcare is pretty cool. What can I do? All right, you know what? I'm going to become a nurse. And I went to nursing school nights and weekends while I ran that company, and got my nursing degree. Didn't do much with it until the end of 2017 when I sold my share in that company, right? I exited
Mm.
because I wanted to get into healthcare in a big way. Didn't know what I wanted to do, but something. And
Right.
you know what happened? I met the most amazing entrepreneur girl living in Brooklyn, New York, and I moved in with her. Like, I'm from a small town in Massachusetts, been there my whole life. It's the kind of thing, like my great grandfather was the one who got us into this town, right? So family's
Right.
been there forever.
Right.
And I moved to the big city. I moved to Brooklyn. I'm like, what is going on here? And by the way, I fell in love with New York City. Like, that's my
Uh,
favorite city in the world. It really
that,
is.
that's
And
where I was born. So
oh
that's my
my
home
God.
city. It'll always have a special place in my heart.
Oh,
Yes.
just when I go over that Whitestone Bridge and I look and I see that city, I'm like, oh baby, I'm home. I'm home. So what happened was she's a pioneer in the cannabis space, and had a CBD company from like 2014. Like, she's early on, right when
Oh,
you can get
wow.
into this, she's
Yeah.
in it,
Right.
with a powerful story of her own, having had cancer, breast cancer, and she couldn't take opioids, so she had to find some other method of pain relief, and
And
that was it.
cannabis was it. Yes.
Cannabis was it,
Hmm.
right? So,
Hmm.
so I'm with her, and she's got this business, and then I'm not in a business, and I have this nursing degree, and I'm like, the I got introduced to CBD, and then I started to do a little bit more research, and then the more I found out, the more I was like, this is it. This is what
Yes.
Nerd's Mark is supposed to be doing right here. This
Yes.
is it.
I
And
love it.
so, listen, Nicole, I don't do anything half-assed, and I got busy. I found the only graduate level master's degree program in medical cannabis science. And it happens to be the University of Maryland School of Pharmacy. Kicked it off in 2019, right?
That's right. That's
I'm
right.
telling you,
I
I
had a guest
dogged
on.
them.
I had a guest on 2 months ago, and she's going through that program right now. I think she's the third class. Yeah.
She's the third class, right?
Yes.
So I'm telling you, I dogged them. They didn't even have an application out. Like, I was on top of these people. They hated to see my name come up. They're like, oh, okay, give this guy an application. I think I was probably the first in line, and
Yes.
I have just graduated last June, and so cannabis has become just a passion, and it
Right.
opened the door for a lot for the discussion around psychedelics, right?
Right.
So I'm big in the
Yes.
psychedelic space as well. My whole thing is about mental health, right?
Hmm.
And and
Absolutely.
and that encompasses everything. That encompasses
Absolutely.
addiction, which we're going to talk about, and depression, which I have struggled with my whole life. So all of these things have come into play because I get introduced to cannabis. It opened the door, and I think cannabis actually did open the door for our discussion on psychedelics today. Like, it was
Yes.
the first thing that opened that door that said, "Oh wow, okay, okay, we were wrong about cannabis, or we were told things that
That's
weren't
right.
correct about
That
it.
weren't true. That's
What
right.
about psychedelics? Oh my gosh." So, anyway, here I am sitting with you today, Memorial Day weekend 2022. I can't think of a better place to be than right here, right now with you.
Oh, thank you so much, Nurse Mark. And agreed. Thank you. I appreciate you willing to jump in here and talk to us about something that's so important. And honestly, we can speak about the elephant in the room, psychedelics, but first I want to talk about the fact that it is Memorial Day weekend, right?
Yeah.
And
Mhm,
there's so many of our soldiers, of our veterans,
mhm.
that are still dealing with depression and PTSD, and don't have access to cannabis. And we
Right.
know in our community, the research proves
Mhm.
that cannabis can help, and psychedelics can help
Yeah.
tremendously with
Yeah.
these type of diagnoses.
Mhm.
And so I, I- as we talk about depression, you mentioned it. You mentioned
Mhm.
that this is something you've been dealing with for many decades, right?
Yeah. Oh, yeah.
Can you tell us? Can you share with us a little bit about how you use cannabis to actually help with your own
Mhm.
depression, and what that
Absolutely.
looked like? How did you discover the right kind of and form of cannabis to use for
Yeah.
yourself?
Yeah. So, there's a lot of as is common in any new discipline, and really you got to look at it that way. There's a lot of conflicting studies, a lot of conflicting information, whether cannabis is good in the mental health space or bad in the mental health space. My
Yes.
personal experience is that it's dose dependent, right? So for me specifically, a very low dose of THC and CBD and all the rest of the plant. I'm always about full spectrum, by the way.
Whole
And
plant.
for
Yes.
people who don't know what that is, I mean, I'm going to assume a lot of people do by this point. Full spectrum means everything that's in the plant is in whatever I'm using, right?
That's right.
So,
No
and
isolates. No.
yeah,
So
no isolates, right?
that means, folks, that the whole plant matter. So that
Yeah,
means that
whole plant matters.
the
Mhm.
products that you're using have the entire plant in it, all the
Yes,
terpenes, all the flavonoids, all
everything.
of the cannabinoid compounds. A lot of
Mhm.
times when you're purchasing products, let's say on Amazon or at a gas station, a lot of times those products are isolate products, meaning that
Right.
they only have CBD in it and they don't have the rest of the compounds that are found in the plant. And that is not the best way to consume the plant.
No,
Nurse Mark is telling
no.
you, I'm telling you as a patient and consumer
Yeah.
that it is not the best way to get the true medicine from the plant. Just a quick brief
Yeah,
explanation for those
listen,
that don't know.
in the research world, I mean, we know that there is a phenomenon known as the entourage effect, which means
That's right.
all of those things together make it all work better.
Better.
We
That's
know that
right.
it's a thing. Like
Right.
everybody in the research community agrees this is a thing.
This is
We
the
don't know
thing.
how it works.
But
I
we
mean,
know
it's
that it
it's
works.
complex. We know that
But
it
we know that
works.
it works.
We know that
Yes.
there's no negative associated with it. So,
That's right.
oh, it's
That's
game
right.
on.
Yeah.
Let's start. So,
And so
to
back
step
to
back to how do I
mhm.
utilize cannabis in my treatment, in my, staying in a very good stable mood state. I'm not in a depressed mode. It really is dose dependent. So very low dose THC, higher dose CBD. I mean, I gotta say, CBD and the minor cannabinoids, they're just spectacular. I mean, that's where a lot of the research is being done because it's not intoxicating and people might be more willing to try it. The general public, right? I mean, I'm all for euphoria, so I'm willing to stretch it a little bit.
Right.
So it is really dose dependent for me, and it's going to be a lower THC, higher CBD sort of variety of cannabis is what I prefer to use.
And in that in learning how to find the right dosing for
Mm.
yourself,
Mhm.
how did you go about doing that? Because you took the course, you
Yeah.
graduated last July, and so
Yep.
were you using cannabis throughout the course as you were learning about the therapeutic uses of it?
Yep.
And then also, what state are you in? Can you remind us what state you're in and what
Yeah.
access you have to
Yeah.
actual cannabis?
I like to say I'm in the state of confusion, but that's a given wherever I am. Now listen, I'm from the great state of Massachusetts, right? I'm I'm
Right.
I'm a New Englander born and bred.
Yes.
And luckily for me, Massachusetts has done a pretty good job of rolling out their medical and adult use program. Like,
Right.
other states have not done as well. Their medical programs are really restrictive, right?
Yes.
Um, so, for me, Massachusetts is a great place to be.
Good.
And it allows me a lot of latitude in trying different products and finding what's going to work for me.
And did you find that tinctures worked better, flower worked better? And in what form did you find that worked better for you
Yeah.
personally?
Yeah. So I'm really sensitive to delta 9 THC. So smoking for me is not the best option, right? Because it's a good flood. People like to talk about, smoking maybe not being the best route of administration in the medical side of things. I
That's
disagree. I
right.
think it's a great one. I think it's immediate and it's a good effect for 2 hours and it's
Yes.
straight up Delta 9. For me, it's about edibles, right? So whether that's a tincture that I'm going to use sublingually or it's an edible product. So yeah.
Okay.
Um,
And when in your experience, have you been working with other patients that have
mhm.
had to deal with addiction specifically? And how have you applied the use of cannabis to those specific patients?
Listen, there are a lot of people that are self-medicating in that space. It's it's hard for someone to have a conversation about this because of the stigma attached with I'm going to utilize something that's been put into that's been
Drug
put into the
category.
space in the
Yes,
drug category of being a very
yes,
negative thing.
yes.
So for me to actually come out and talk to somebody about it, so I don't work with a ton of people who, come to me and say, "Hey, I'm in addiction, I'm in recovery, and I want to use cannabis." It's sort of like we just have a side conversation somewhere, and then we start talking and working
Getting
together.
more.
It's not
Yeah.
like we're going to seek it out. It's like we have a conversation somewhere because there is a stigma attached to it, and especially in the recovery area. And for somebody who's in recovery for, let's say, they're using methadone and they have an opiate addiction, right? So they're using methadone. Well, in Massachusetts, and I'm going to assume that this is the case everywhere, and I may be wrong on this, but in Massachusetts, if they test positive for cannabis, they're out of the program. Like they're done. They're not getting methadone anymore.
So, okay. So let
Yeah.
me ask you this. I never really understood because they
Mhm.
say you can't use cannabis if you're in addiction recovery, but
Yeah.
methadone is used in addiction recovery for opioids. Isn't methadone a drug?
Well, yeah, yeah, it's an opiate derivative, right? So it's being used to treat it. Yeah, I know. I know. Listen, it doesn't make sense, but that's what we have to work with right now in the
Right
space.
now. Yeah.
That's what everybody's been trained to do, right? And everybody has been given evidence that this is the best thing to do.
Interesting. Okay, so I know with my own personal journey, when it comes to addiction, I personally was able to stop cold turkey. No problem at all. I mean that my but my incentive, my
Mhm.
what pushed me into that direction was getting diagnosed with HIV.
Yeah,
So it was
yeah,
one catalyst in my life that shifted me to make me
mhm,
realize, okay, my health is so important to me. How am I going to make this change and do
yeah,
it in a way that's going to positively affect my
mhm,
life?
yeah,
And so giving up cigarettes, giving up cocaine,
yep,
giving up sex, because those are the things that I was addicted to, alcohol.
yeah,
I was using it to try to deal with my issues in grief and dealing with grief and guilt
mm,
after losing my dad and my sister in a car accident
oh
on their way to my 25th birthday party. And
my
so
gosh,
me not understanding how to manage that great grief and guilt
mhm,
led to these addictions.
yeah,
And so for me, waking
coping
up in the
mechanisms,
hospital, right,
mhm,
waking up in the hospital after being diagnosed with HIV, it was a very easy decision for me to say no more of anything that's going to harm my body.
right,
And so
right,
it was very easy for me to quit. But what I did pick up, I gave up pain medicine at the same
mhm,
time because
mhm,
I realized that it was affecting my liver and my kidneys, and the virus was strongly affecting them. So
mhm,
I wanted to figure out a form of plant medicine that I can use to help manage pain. And I knew that cannabis could be that medicine.
right,
And so I never hesitated. I completely got off pain medicine and
mhm,
all of my addictions and went straight to cannabis and all plant medicines. And I never looked back. But I know that ideally, not everyone has access to that same path. And so when you're dealing with patients that are enthralled in addiction, they
mhm,
might not be in a state, they might be in Massachusetts where they have access to cannabis and plant medicine. What do you said you have a conversation, but what are you educating them about the endocannabinoid system, about terpenes? Does that conversation come up as well?
yeah, that comes up in every conversation as soon as we start talking about, hey, listen, I heard CBD might be good, or I heard,
Yes.
cannabis might be a way that I can sort of work with, feel better, as
Yes.
I'm going through this time. Of course, it always starts off with that education of, well, let me tell you why it works. Let me tell you
Right.
why it's so powerful, right?
Right.
I spend a lot of time doing that, educational events and talking to people about this. And that's always the start of the conversation is like, well, let me tell you why it works in your body. I mean, it's the
That's right.
craziest thing.
You're
Yeah.
right. It's the
Craziest thing
craziest
that we
thing.
found these cannabinoid receptors in our body, and we're wondering why do we have cannabinoid receptors in our
Yes.
body,
And
right?
why does the cannabis plant, the only plant on the planet that has phytocannabinooids that
Yeah.
respond to this
Yeah.
system, right?
Well, that was
Um,
the question, and because we were looking at THC and really THC is what the research was being done back in the day because
yeah.
they were like, oh, this is intoxicating, this is interesting, let's take a look at this, and they found that THC did connect to a cannabinoid receptor, and then they had to wonder, well, why the hell does the human body have receptors for a plant? This makes
Plant.
no sense, right? This makes no sense. Well, that led
Right.
to the discovery that we create these cannabinoids in our body like
Right.
naturally. Oh my gosh, it's just fascinating.
It is.
And yeah, so here we are. I love
And
that. I see that pop up. We just got a comment that says cannabis is not a gateway drug. There is no such thing as a gateway drug. Let me tell you,
that's
if there
right.
was a gateway drug, for me, it would have been alcohol because
That's
that was
right.
the first drug that I picked up. I
That's
stole a
right.
bottle of my daddy's whiskey and that was it. That would be my gateway drug. But there is no such thing as a gateway drug. We have dispelled that crazy thought. There is
Yeah,
no such thing.
absolutely. There is
Yeah.
no such thing. And
No,
in some communities, it is known as and Dr. Adams says it is an off ramp, not
it
a gateway.
is.
It is. It's an off ramp
Yep.
to addiction. It is an
Yeah.
off ramp to depression. It is an off ramp to pain, managing pain. And that keeps coming
Yes.
up because a lot of times when people are managing addiction of
Mhm.
whatever sort,
Mhm.
mine came in many forms from being addicted to drugs and physically sex.
Yep.
But people can be addicted to anything.
Absolutely.
Right?
The human
There's
brain's an
research.
amazing thing. I mean, it just gets wired to do things. I mean, it's not, we have this ethical commentary going on about addiction. You got to get rid of that. It's not choice. It's just like we get
No,
wired in these certain ways and our brain gets patterned to do these things. And yeah, well,
absolutely.
guess what? Drugs happen to light these circuits up really nicely and give us that reward. Whatever it is, that drug could be
Whatever it
sex,
is.
could be food, I know a ton of people who have food addiction, right?
Absolutely.
Like they have weight
Absolutely.
problems. They know how to lose weight. They know what they should be eating. The knowledge doesn't do a damn thing because they're wired to have this response.
Absolutely.
Yeah.
And as I was doing my research, just getting ready for today's conversation,
Hmm.
understand that there are white papers out there that say that cannabis causes psychosis. That cannabis is not a safe way to get off of opioids.
Hmm.
But you have to consider, and you coming from the medical
Right.
industry, medical world,
Yep.
I'm sure that you've run into negative propaganda saying, "Oh, cannabis is the gateway drug. You
Sure.
shouldn't be using it in recovery." And usually, what is your? How do you combat that? How do you tell your other medical
My gosh.
professionals, like,
Yeah.
look, this is working? What is the conversations that you have around that, and how can other nurses and medical professionals utilize what you've learned?
Mhm.
Maybe talking points that you can give them about how to have these conversations with other medical professionals that have been programmed in the wrong way.
And that is really what it is. It's programming, right? So what
That's
what what we've been taught, I mean, we're not taught, still not taught, the endocannabinoid system in nursing school, in medical school. Very, very little information is in there. It's starting, right? I'm in a psychiatric nurse practitioner program. My pharmacotherapy textbook this semester actually mentioned cannabinoids, very small, but it was
but it
mentioned.
mentions,
So it's like
yes.
it's entering very slowly. But when I would first start off having this conversation, I was so passionate about this subject that I would literally get angry when somebody would confront me with this silly talk of, cannabis is horrible. It's a horrible drug. You should never do it,
Right.
and it should never be in healthcare. And I would really get combative. And then I
Mm,
realized I'm not going to win anybody over having this kind of an attitude. Oh
right.
hell no. I'm
Got
just going to solidify their negative thought about this, right?
Opinion. Yes,
So
yes.
what's in play here, Nicole, is something called cognitive dissonance, right? It's a psychological phenomenon where if somebody has a belief about something, a firm belief, they are going to hold on to that belief no matter how much evidence you give them that's
To the
contrary
contrary.
to that belief.
Right.
And it could be
Hmm.
solid scientific evidence, which we do have for
Right.
cannabis as a medicine.
Right.
People will firmly hold on to that. So, how do you combat that? What's the conversation? It's a gentle, inclusive conversation about how powerful this medicine is, right? So we really want to. I have this conversation with compassion and love, and I say, listen,
Mm.
I understand that this is the opinion that you have now. Consider that you don't have the full story. And let's take a look at some of this evidence-based research that's been done. And then I go into this whole story about, hey, listen, we couldn't research it here in the United States because it's illegal. Israel's been doing research for 50 years
Right.
and significant scientific research. So let's talk about what they've done. Let me
Right.
show you. So
What
that's how
they've done.
you know what? You just got to lead somebody in slow and easy. And I have had success in getting other medical professionals to take a look.
Oh man, that is
Yeah.
fantastic because it is a hard road. And as an advocate, I know having these conversations with people that just don't understand the plant as medicine.
Right.
So as adult legalization is happening
Mhm.
all over the country,
Yeah.
and our medical programs in all these states where there's adult use, just so
Mhm.
everybody understands, every state that there's been adult use legalization, there first was a medical program.
Yeah.
Why?
Yeah.
Because
Yeah.
we had to prove, we meaning advocates like Nurse
Yes.
Mark and myself, had to
Mhm.
prove to legislators that there was a viable reason to use this plant. So
Yeah.
there's never been legalization path ever. There's never been a decriminalization path that started with adult use. That is
No.
what comes after many years of a medical program. So, how do we make sure that the medical programs remain constant and intact in these states? Because that's what's happening, right?
It
In
is.
every
It
state where it
is.
goes adult use, our
Yep.
medical programs get left behind.
They
What
do.
do you think? What in your opinion feel like? What is our path to making sure that we keep medical at the front of the conversation?
Oh gosh, it really is an issue because for the most part, I'll give Massachusetts as an example. There are qualifying conditions, and this is true for every medical program, and some are
Right.
just ridiculously tight, and other ones are a little less restrictive, but they're restrictive by nature, right? So
That's
they
right.
say you have to have these qualifying conditions in order to get a medical card.
That's right.
Now, if you have an adult use state, you can walk in and buy this product without having any condition other
That's
than
right.
I want to buy this product.
That's right.
So in my eyes, we need to get rid of these restrictions within the medical side and allow physicians and nurse practitioners and folks to help people utilize this as a medicine. Other than that, they're just going to walk in and try this stuff. And worst case scenario is they have a negative experience and never try cannabis again. And how
Right.
awful is that they could actually have utilized this as a really truly powerful medicine? And I like to
Medicine.
say that it is probably the safest and most effective medicine that we have in the healthcare space today. If
Absolutely.
you look at the safety profile and the side effects and all of the things that it can do
Mm.
positive in the human body, I don't think you'll find another medication that is as powerful as cannabis.
Agreed. And
Mm,
that's why I utilize it, honestly. And
yeah,
as we talk about addiction and depression and those things that correlate to with each other,
yeah,
um, you know, these medical programs that are in states, most of the time, when you go to a medical office, when you go to a doctor's office, the first person you see is a nurse, right?
yeah, yeah,
When you go to a hospital, the first person you see is a nurse.
totally.
Uh, and I feel like a nurse's calmness and a nurse's care is just a little bit more personal than maybe the
Mm,
doctor, depending on the type of doctor.
right.
And do you think that we should have nurses being able to recommend medical marijuana cards within the states programs that have medical programs? Right now, they can't, and I think that they should.
No, they can't. They can't.
Yeah.
I mean, they're gonna. it's going to be a hard battle to make that the reality. Now, if you want an
Mhm.
APRN, a nurse practitioner, that's an easier battle to have. And there are many states, I think most states will allow nurse practitioners to certify medical marijuana patients. I
Yes.
know I don't think Florida is one of them. I mean, because I was living in Florida for a while and I took a look at their program. I don't think that nurse practitioners are allowed. But even in that space, nurse practitioners, APRNs, advanced practice registered nurses, they are being given full scope of practice rights in many states. Thank God, way overdue. And so I do think, however, that nurses should be allowed to certify patients. I just don't think it's going to be a reality for a
It's a
very, very
hard
long time.
battle.
But I'll tell
Yeah.
you right now, Nicole, nurses are leading the way in this space of medical use of cannabis. There are so many nurses who are on board in working. I'm a member of the American Cannabis Nurses Association, the Cannabis Nurses Network. I mean, these are two fabulous, fabulous, fabulous. Yes, cannabis nurses of color.
Yes.
Yeah,
We love our,
friends,
yes, yes.
family,
We
family.
love them so much.
Well,
Yes.
we and I do too, and I do
Yes.
too. It's so
Yeah.
magnificent nurses leading the way because you're right. They're the largest community of healthcare providers. They're
That's
the
right.
most trusted healthcare
That's right.
provider in the system.
Yeah.
Why? Because we give a shit. We care
Yes.
holistically about you as a person.
Yes.
Like we're going to have a conversation about whatever's going on in your life, not just this specific thing that you're dealing with at this moment.
Absolutely. Yeah.
Yeah.
The nurses have to dig into your history. They got to ask you
Yeah.
all these questions and kind of get to know you as a person and as a
And that's
patient.
what you need
That's exactly what you need. And
when
and
you're
a lot of
talking cannabis.
times,
Mhm,
that's right. A lot of
mhm.
times you're more willing to tell your nurse that you might use cannabis versus the doctor, right? And the
Yeah,
nurse has to take that all into analysis as they determine what might be the best way or what
of
they're going to
course.
tell the doctor of what might be
Yeah,
the best way of treatment,
right.
or what even the diagnosis might be, which is
Mhm,
interesting. Okay, so we touched on why cannabis and the endocannabinoid system
yeah.
responds so well
Mhm,
together,
mhm,
and how the brain is really
mhm.
where your addiction is, right?
Yeah,
It's in the brain
yep.
because like you said, you mentioned earlier,
Well, it's everywhere, but it's primarily, I mean, the brain is running, but it's a full
yeah,
body
it's a
experience.
full body
Yeah,
experience,
yeah.
absolutely, no doubt. But those receptors in our brain that are looking for that satisfaction comes in many different forms. And
Mhm,
so when we're talking about how we use plant medicines in general, not
mhm,
just cannabis, let's say, but plant medicine that helps us to manage and deal with addiction or depression or
mhm.
anxiety or PTSD. Um, I know for me, what was a tremendous gift was using psychedelics.
Yep.
That helped me so much in helping with my recovery, my addiction recovery, but
Mhm.
also just spiritually in general, how I utilize the plant. I mean, before
Yes.
when I was in college, I was using psychedelics. I was using mushrooms to have a good time.
Yeah.
But once I got into this health and medicinal use of plants, I
Mhm.
understood how powerful of a medicine psychedelics like
Oh,
psilocybin can be,
yeah.
especially when we're talking about your brain and the responses in your brain and how that works to help you with recovery.
Mhm.
So can you speak a little bit towards what your experience has been in using psychedelics with
Oh,
addiction
yeah,
recovery? Yeah.
yeah. Uh, spectacular, spectacular modality, just
Yeah.
amazing. Uh, and as I said, I think cannabis opened the door for this whole conversation to begin. It certainly did with me. And I've been in the space of working with psychedelics for the last year and a half and a ketamine home therapy startup. So, ketamine I'm considering to be a psychedelic for sure. In it's it's an amazing time to be alive and to be in the space of mental health care because we have these tools that psychedelics, Nicole, there's a ton of research that the government did in the 50s and 60s before they shut it down.
Yes.
So we
That
have a
proves that this
lot
works.
we have a
Yeah.
lot of research that can't be denied, and there's a lot
Yeah.
of research going on now. So there are so many different things that we can do within the in the psychedelic space to treat, like PTSD, for instance. A lot of studies are being done around MDMA, which is, a synthesized drug, but it's a sort of a pseudo psychedelic. There's a
Yes.
lot of work being done around MDMA and PTSD and being able to, touch
Recover.
those memories and those
Hmm.
experiences without all of the emotional triggering that happens, right? So it
Yes.
allows the person to actually touch it and feel it and resolve it. And
Hmm.
it's amazing to see in these sessions, um, what happens and see the results afterwards for someone who is profoundly affected by a traumatic experience to be able to walk free and be in life again. I mean, it's just
Amazing.
yeah, it's
It
amazing. And
is.
the thing,
I've seen it.
so many things that we, you know, are going to be able to do with this.
Yeah,
Yeah.
and as we're talking about traumatic things and
Mhm.
PTSD,
And
you can
addiction.
imagine, yes, which can lead to
Well,
addiction.
yeah, all those things. I mean,
Obviously,
if you have PTSD, what are you going to be doing? You're going to be self-soothing in any way you can. So of course
that's
you're going
right.
to have substance use disorders and abuse. Of
That's
course
right.
you are, because you're in pain, right?
That's
You're
right.
in pain.
That's
You're
right.
going to do what you need to do to be out of pain, even
That's
if
right.
that's not a positive thing for you
And
as a whole. Yeah.
and that's why we find so many of our veterans that
Hmm.
are caught in this addiction spiral,
Yeah.
because they go into the clinic and say, I have
Mhm.
PTSD, obviously I'm depressed, I can't sleep, and they
Yeah.
diagnose, they give them opioids as treatment, versus cannabis, which we know can help,
Yeah.
versus psychedelics, which we know can help. With the trauma
Mhm.
of this past week, of the shootings that happen in the schools,
So
and
horrible.
even though we might not know these people personally,
Mhm.
watching it and understanding that 19 babies were killed,
Yeah.
if you're sensitive, if you're an empath, if you're
Yeah.
out there watching the news, this can have a negative effect on how you perceive happiness, on your it could trigger an addiction, it could trigger trauma.
Yeah.
And so understanding that these things,
Mhm.
you might not have to physically have been in Texas or know any of these families or any of these students,
You're
but
affected.
just watching it, yes,
Yeah.
you're affected. and
Yeah.
and if you already have been dealing with an addiction, you beat it, it's out of your life.
Yeah.
And seeing something like this, let's say you were in a school shooting before 10
Mhm.
years ago,
Yeah.
how what are the paths, what are the ways, for someone who is dealing with depression, they don't have access to cannabis, they don't have access to a nurse mark.
Yeah.
What would you say, what advice would you give to the individual that is struggling, that is really looking for solutions?
Yeah.
It's hard if you don't live in a legal state, like a state like
It's
Oregon.
hard. Yeah.
In Oregon, they offer all psychedelics. All
Yeah.
psychedelics are legalized now and basically
This is
legal, that you have
and
access to
oh
them.
my gosh. Yeah, I mean, that is just such a there's such groundbreakers out there. Like, they understand that they want their constituents, they want the people who live there to have access to these plant medicines, these amazing healing modalities. And,
That's right.
kudos to them for breaking that stigma around that, because that allows other states to start to have that conversation, right?
Conversation. Yes, yes, yes.
Yeah. Yeah.
And so do you offer coaching services, like
Yeah,
for
oh, of
medical
course.
professionals or
Yeah.
for consumers or clients or
Mhm.
patients outside of your state?
I do.
What, okay, so tell us a little bit
Yeah.
about that.
So, you just asked Nicole, what would I tell somebody who's in a state where they can't access cannabis and they can't, they don't have access, of course, to psychedelics because they're still restricted. Uh, what would I tell them to do in regard to having all of these, horrible incidents that are happening in the world? Um, what I would coach somebody on, number one, is start meditating. Like I coach people on how to start a meditative practice. And the first thing that everybody says is, "Oh, I can't meditate." Yeah, no, my brain's
I, or
my
I don't
my
know
brain's
how. I
my
don't know
brain's going
how.
crazy all the time. And I get that all the time. And I'm like, yeah, welcome to being human. That's true for everybody. It doesn't
Right,
matter who you are. That's how your
right.
brain works. You have this
That's
stream of
right.
consciousness. Thoughts are flying all the time. Guess what? That's why you need to meditate, because
That's
all
right.
that is just practicing, observing those thoughts going by. It's not shutting them down. So
Right.
for me, that is like the baseline place to start. Like I always start people there, and anybody can do it. Listen, one of my first diagnoses, and I love labels because in the mental health space we got some good ones. My
Yes.
first one was ADD, so
Mm.
attention deficit disorder.
Mine too.
Okay, so
They tried
guess
to
what?
diagnose
Guess
me in
what?
4th grade and put me on
Yes.
Ritalin.
Oh
Yeah.
my gosh. Yeah, no,
Mhm.
they didn't get me that early. I mean, I was having behavioral issues in that time period, but they didn't have that label then, right?
Right.
So if I can do it, and it is the basis for everything that I do in treating my depression. The basis is meditation. And I could go in, like I do presentations about just meditation and
Mm.
talk about physically even what happens in the brain when you meditate. Like you grow
Mm.
new brain cells meditating within 8 weeks.
Mhm. Mhm.
Says,
It's
I'm telling
amazing.
you, I've done some things in my lifetime that have taken some brain cells away. I
Away.
like to grow new ones, right?
Wow, that's so powerful, Nurse
It
Mark. I
is.
mean, I
Mhm.
introduced meditation and mantras
Yeah,
to Roz when she was dealing with
yeah,
her traumatic brain injury last year, and it
yeah.
made a world of a difference. It
Mhm,
inspired
mhm.
Black Buddha Cannabis. Shout out to Black Buddha Cannabis. But that experience for her, not being a cannabis user and then
Mhm.
using cannabis and then incorporating mantras and
Yeah,
meditation
yeah,
and those things were hugely made a difference for her in her recovery.
absolutely. Yeah.
And so
I
that's
mean,
amazing to
TBI
hear
and
you say.
cannabis, that's huge. That's huge. I mean,
Absolutely.
we have lots of evidence.
That shows, yes.
That
And I
shows. Yeah.
that and Roz McCarthy is a walking testimony. She will tell you anytime that she said speaking to your brain is real. Yes. And that's what
Of
mantras and
course.
meditation is. You're
Yeah.
calming your body and your mind enough
That's
and
it.
using breathing practices to make sure
Yeah.
that you can talk to your brain. Like you
Mhm,
tell your
mhm.
brain what to do, not the other way around.
That's it. That's it. You get to be the observer. You get to have a say in what's going on. Because for the
That's
most part,
right.
we're all just automated going through the process.
That's it.
Yeah.
And tools like meditation,
Yep.
tools like cannabis help
Absolutely.
us with those processes. All of
Yeah.
us are going through it. And we're just saying that cannabis and meditation and
Yeah.
eating a clean diet, those
Yeah.
things
All
all
those
help
things.
with making you feel better. And
Yeah,
it's
and if
been
you wrap
proven.
that back into addiction, like if you're in this space of trying to treat your addiction, now, addiction changes the brain,
That's
right?
right.
We know that it
That's right.
changes the brain. Like there
That's
are
right.
physical changes that occur when you're in this, addiction mode. And so anything that you can do to mitigate that, right? Like
Yes.
meditating, like utilizing cannabinoid products, right? Things that are going to heal that change that was made in the brain with this addictive process. I think it's huge. I think everybody in the addiction space should be meditating for sure.
I'd have access to it. Absolutely. Okay,
Yep.
so real
Yeah.
quick, I want to kind of go through what has been your favorite thing to do. As you have newly been introduced to cannabis, maybe
Yeah.
what is your favorite thing to do with cannabis? That was your favorite thing to do before, but even better now that it's with cannabis.
I'm a huge fitness fan. I'm a
Okay.
CrossFit level 1 coach, and
Oh wow.
I've been in the fitness thing. Well, I went in the Marines when I was 17, right? So I had to start
So
working out. I
yeah,
had to stay trim and fit to pass the test every
absolutely.
year. Um,
Absolutely.
yeah, so, for me, fitness is a huge thing. I love weaving cannabis into fitness. Like, I'll take a little 5 milligram edible an hour before I'm going to the gym, and I'll get to the gym and I will be super focused. I will not be achy and the pain will be decreased, right? So for
Right.
me, that's a beautiful combination is to add that, cannabis and working out. I think it's
Oh,
spectacular. Really
oh,
is.
we could talk about a whole show about that. I mean,
Woo!
fitness and cannabis,
Yes.
yes,
Yes, we
amazing.
can.
I think one of my favorite things is microdosing and hiking.
Wow.
Of course, I always love cannabis with everything that I do, but
Yeah.
microdosing and hiking is a whole new level of hiking. It's not the
Oh,
same
isn't
kind of
that good?
hiking.
Yeah.
And
Yeah.
I'm talking about microdosing with psychedelics, not
Uh-huh.
necessarily cannabis.
Yep.
And that's a whole nother conversation as well.
Oh
Okay,
my
so what
gosh.
about what about your favorite book? What is your favorite book that you've read lately, that you would recommend to those that are listening?
Oh my gosh, I read so many books,
Mm,
and I reread a lot of books because,
mm,
I get a lot out of them.
absolutely.
I really enjoyed like Conversations with God, Neil Donald Walsh. I like his
Oh,
stuff.
that's a
Like
good
those that whole
one.
series really changed a lot for me in regard to religion and
Mm,
spirituality and all this.
mm.
Um, I've been doing a lot of reading, within the psychedelic space. So there's a lot of great books out there that you can grab and really look at what's going on. For me, I really like to get into the nitty gritty. So I got to be honest with you, I do read a lot of research papers.
Of
I
course.
like to see what's going on at the
Of
cellular
course.
level. You
Of
know,
course.
yeah,
Yeah.
kind of boring. I know, kind of nerdy, but damn, I love it.
I'm me too. I'm a big research white paper fan,
Yeah.
especially in this space, and being able to talk to patients and talk to
Hmm.
everyone. It's important for me to know what's happening in our world.
Yeah.
And so I'm a big nerd out on research papers as well.
Oh,
I love it too. So what is your favorite vacation spot? Like is there a favorite place to visit?
oh my gosh. That is a really difficult question to answer because I love new experiences. So there's so many
Right.
places that I haven't been. But if I had to say where if I wanted to go on vacation, it would either be Italy or France. Like
Ah,
I just dig the food and the culture and I just love it. Yeah.
ah,
Yeah.
me, it would
And
be
I
the
may be headed to Italy here shortly
oh,
for a
awesome.
little experience. So kind of excited about that.
Okay, so tell us, what are your projects? What are you working on right now that you want us to know about, that you want to share with us, that is important to you?
Yeah, so I am really getting out there on the public stage in presenting, keynotes around psychedelics, around, why they have reappeared at this particular time in human history. I mean, I think that it's not coincidence, it's not by accident by any means.
Agreed.
We're at a point where technology has outpaced our capacity to take it all in, right? We
That's
can't
right.
keep up as a human being. And
That's right.
evolution takes millions of years to change things, right?
Right.
Psychedelics are going to allow us to
Change much
embrace this
faster.
world, right? Embrace
Yeah.
this world and really move things along. And I really do think that it's going to change humanity in a very positive way. And I'm so excited to be a part of that. So I'm out there talking about these things, especially in the entrepreneurial community, right? So I like to be my goal when I sold my shares in the last company I get into this healthcare space was to impact millions of people in a positive way. And so my being a nurse practitioner is not going to do a million people, right? I'm going to get one at a time, which is super meaningful, and I will do
Of
that.
course.
But I'm
Of
about
course.
millions of people. So how do I do that? I need to affect and bring the people who can affect millions of people into my way of thinking, into this new world. So what am I going to do? I'm going to get to the leaders. I'm going to get to the entrepreneurial leaders. I'm going to get to the political leaders, and I'm going to bring them, educate them, bring them on board. And
Mm.
that's how millions of people are going to be served. Yes.
That's
Yeah.
beautiful. That's
Yeah.
amazing. How
So
can we help you with that? Is there anything that consumers or patients can do, or other medical professionals that are
just
as passionate
keep,
about plant medicine?
yeah, just keep spreading the word wherever you go.
Right.
Just but do it with love and compassion. You know what I mean?
Right.
I know
Yeah.
we get really super passionate and angry that this ludicrous, crazy world we live in, like, tobacco.
Ignored
Let's
the
talk
yeah,
about tobacco. 500,000 people a year die from tobacco-related
that's
illness,
right.
right?
That's
And it's
right.
still a
That's right.
legal product you can buy anywhere you want. So
That's
not
right.
having cannabis federally legal is such a ridiculous
Concept.
concept, right?
Yeah. Yeah.
Right?
It
And
is.
that's what we're
Yes.
here to do, is to try to get this change, and psychedelics as well. But what I'm doing right now and how you can help me is right now my website's being updated. There will be a big button on the front that says right here, right now, donate. And that's all about ending veteran suicide. Okay, we talked about it
Mm,
early on. So mental health issues in the military veteran community is at an epidemic level. The highest
Yes.
cause of death in the US military today, right now,
It's
is
suicide,
suicide.
not death at
Suicide.
war. Right. They're not dying in
Okay? More
war.
than any
Yeah.
other cause of death, suicide is it. So I'm not willing to just sit with that anymore. And it's been years that this has been the case. So I'm kicking off a campaign to raise money to treat veterans using psychedelic medicine because I know that it works and we can legally do it in the United States using ketamine. So to pay for those sessions, because it's not covered by insurance and the VA doesn't cover it, pay for that, where I'm doing a fundraising campaign and everybody gets a little bracelet, a little right here, right now bracelet. I don't know if you can see that, but it's right here, right now, right?
Yes.
So everybody gets one of those. And here's the thing, life happens right here, right now. Like this is life for us right now.
Right now. That's
right here, right now. So the bracelet idea is anytime you're in a situation, you recognize that you're not there, which is most of the time. When you want to be present, you just close your eyes, snap that, take a big breath and say, right here, right now. And that's where you'll be.
I love that.
So, double it up.
Thank you for your service, Nurse Mark.
I know. Yeah. And so I am a veteran. Yeah. I'm a Marine Corps veteran. Ooh, I know. Us Marines, we have reputations and well earned, by the way.
No, but you are reaching back to your fellow comrades and making
my
sure that they are taking care
out there doing the work.
That's
less
right.
than 1% of the United States population ever serve in the military. And we ask them to basically give up their lives. Like they can, it doesn't matter where they go. Oh, and by the way, they have to do it whether they agree with the political people who are in office or not. That's
right. They have
you may
to be
not agree with
apolitical.
who's in office, but you got to go do the job.
That's right. And they do it. And they do it. And they protect us. They protect our freedoms. I don't know if I have it in me to make that sacrifice. I'm fighting this battle in my own way, fighting, the prohibition of cannabis in my own way. And that's its own fight. But man, what you all do as veterans and protecting our rights in our country, we just can't say thank you enough. And
we can't leave.
Folks,
we can't leave them. We can't
that's
leave them
right.
behind.
We
That's
cannot
one thing
leave
we never
them
do.
behind. We have to remember that they come back from war, that protecting us and our rights and our freedoms, and they are not taken care of. Our government is not taking care of them.
But they're limited to bureaucracy, right? I mean, bureaucracies do not move quickly.
And that's right.
And of course, with the legal status of a lot of these things,
prevent them from using it.
And so people are dying. Let's not let that happen.
That's right. And we have to remember as individuals and citizens, what we can do is vote for legislators that support legislation to have cannabis use
the only way we're going to get it done.
That's right. That's right.
The only way we're going to get it done. Yeah.
Oh, wow. Nurse Mark, thank you so very much. Thank you so much on this Memorial Day weekend for spending a little time with us, sharing with us your program. Right here, right now, visit nurse-mark.com. His website should be up in a few weeks and you'll be able to go there and donate. Man, thank you so much, Nurse Mark.
Hey.
We really appreciate you. Thank you so much for your service and for all the work you're doing. Thank you so much.
Keep up the good work. Yeah.
Thank you, sir, so much. All right, y'all. Thanks again for another great episode of Health is Wellness. Thank you for joining us. We hit some really amazing points today. Thank you to Nurse Mark for joining us. If you want to learn more, please follow him. Reach out to Right Here, Right Now campaign. But you all have a fantastic Memorial Day weekend. Stay healthy, stay happy, and stay in wellness. Thanks so much again. Take care, everybody.